Well, the number of multiples born in the U.S. is at an all-time high.
And with the rise in multiple births, there can be an increase in moms having a high-risk pregnancy. That's this week's Your Health Matters report.
Up to 15 million babies were born prematurely in 2018. Medical advances have increased the baby's survivability. Reasons for early delivery are varied, and many start with the mother's health. Some of the risk factors include high blood pressure, preeclampsia, gestational diabetes, and multiple births.
Those are all complications of pregnancies that affect mom, but also increase the risk of prematurity.
By definition, prematurity is when a baby doesn't make it to 39 weeks gestation. With prenatal care, the risk signs can be addressed by doctors, but there is one key thing mothers-to-be need to do.
It's also important that moms are having an open and honest discussion with their OBs when they're not feeling well. Typically there'll be a detailed ultrasound around 20 weeks.
Twins, triplets, and quads are higher risk pregnancies and are at risk for prematurity. Complications can occur when twin babies share a placenta, ranging from the unequal sharing of the placenta, where one twin gets more from the placenta, affecting the other twin's growth.
When you have two babies sharing a placenta, nature doesn't just divide it in two and say you get half, you get half.
A more serious problem is twin-to-twin transfusion syndrome. That's when the sharing of the placenta is taken to an extreme and blood flow is disrupted between the twins.
That flow can become unbalanced, and then one twin is getting too much blood and the other twin doesn't have enough blood.
If unchecked, this can become fatal for one baby, prompting need for fetal surgery.
That's where we can intervene by going in with a laser and photocoagulating the connections between the two twins in disrupting that flow so that the flow becomes balanced between the two twins.
And it's procedures like this that attribute to the survival rate of premature births.
Babies that are born at certain levels of prematurity now are fairly routine in their care. Now, in instances where the babies don't make it to 39 weeks, and we have an entire multidisciplinary team that function out of our neonatal intensive care unit to help support those babies and give them the best chances of having a good outcome.
And with multiple births continuing to rise, early and comprehensive health care for both mother and baby are even more important. I'm Tom Dempsey for Your Health Matters.